For those of you just joining us, and this is a pretty good number for a snow day, please put any questions that you have in the chat box. John Bowser, my colleague and friend who is also working from home, will be monitoring the chat box, and I'll check periodically with him because as I start rolling through this, it's pretty hard for me to keep track. So one of the things that I just want to welcome all of you to is the fact that, and I will share this again, there is a date error on the application. We are working to fix that, but our web person who does fix that is has not been in. And so I want to make sure you understand the due date for this application, you'll hear this multiple times, is May 1st. While the application says May 31st, please disregard that. We will have a new one up, and I will explain why that is as we go through. But please note it is May 1st. So the other thing that I would like to get started with is to let you know kind of what we're going to talk about in this. There's a few changes for those of you that did the application last year. I'll explain those as we go, but a little bit of the overview, some of the things about what's new, important dates, that May 1st will come up again. We've decided to do these grants in 2 categories. I'll explain that process. Some how-tos about completing the application and the budget. The budget sheet on these applications is challenging, and I acknowledge that, but it is what we have for our software applications, and so we're limited to that, but I will give you some tips about that. There are required activities for this grant, but then there are also a number of allowable activities, and after going through 1 year of the grant process, we've got a pretty good idea of different activities that communities decided to do with their funding, and I will share some of that because if you're kind of struggling to think about what this could look like at a universal Tier 2 and Tier 3 level, I can share that with you. And then just some information about developing a plan. We're going to go through this quickly, but this webinar will be recorded and will be online. You will have access to these, this PowerPoint or this Google Doc, as well as another one that gives you a little bit more detail that I did for a conference on how to, tips for different sections and things to include. But we want to give you more information or as much support as we can in how to write these plans so that they're good plans, because this is a competitive grant. I will say that multiple times as we move through. And why did it freeze? There we go. So we're taking a look at, on the left, you will see the statute. This grant program is authorized by Wisconsin state statute. So legislature put this into law. The good thing about that is that means that it'd be pretty difficult for this program to go away. They'd have to go in and change the statute. It's possible, but we anticipate moving forward. Eligible applicants, just as they were before, remain school boards of public schools, generally speaking. We've had a few questions. If you're not sure whether any of these apply to you, email me and we'll check. Operators of charter schools, and then a consortium of any of these. So, for example, we had consortiums that build up through CISAs, but we've also had consortiums of local school districts that decided to partner together and write their applications, and we had a number of those funded this year. And in anywhere from 2 to 6 different districts in some of these consortiums. It's not a bad way to go if your small district and your resource allocation is pretty limited and you think you could share those resources across districts. Grant awards, just as last year, you have an opportunity to apply for anywhere from a minimum of $10,000 to a maximum of $75,000. And keeping in mind that, and this is exactly what happened last year, that we want you to choose the amount that you think is going to be most useful for your plan, rather than just try to figure out how to spend $75,000. The plan should drive the amount, and I will say that, and by and large, that was the case last year with applications. The other thing is that you are required to have an MOU or a letter of commitment from at least one community mental health provider partner, who's going to collaborate with you on building this comprehensive school mental health system for students. We had to disqualify or not even review one grant application last year because they did not provide this. Your CISA is not a community mental health provider. The guidance document that is also on the website does define community provider for you if you're uncertain about what that is, but that has to be included in this project. It is essentially what the grant was written for. So when we take a look at the statute for this grant program, it pretty much is the purpose of the program to collaborate with community mental health agencies to provide mental health services to pupils. That does not mean that it is all that it is, but that is the general purpose, to increase access to treatment and resources for students. So as you're going through, just 2 questions to ask yourself as you're creating this plan. Does your grant plan and activities support collaboration with those community mental health providers? Are they included in the planning? Are you talking with them about what they're doing as supporting you in this work and how you're going to work together for that? And is the grant activity or support to improve the provision of mental health services to students? So what we learned from the last round of grants is that we had 140 applications, and we funded about 52, 53 of those, considering those applications included, in some cases, multiple school districts in one application. We had over 800 million, or over 8 million requested for these grants, and we had 3.25 million to award. We know that there are significant shortages of both school and community mental health providers across all applicants. We know that this is the case. We know that even in larger communities where there are a number of providers, there are still significant wait lists for students, so we understand that that is a challenge. And we also know that at this point moving forward, one of the questions you might have is that we are assuming that we will receive at least 3.25 million again with this budget cycle. However, it could be appropriated at a higher rate. Governor Evers, before he left the state superintendency, submitted a DPI budget proposal to the legislature that requested a significant amount more for this grant project. We don't know what that will be until a budget is passed. So keep in mind, we're presuming that we have 3.25 million. If we have more, we will award more. So the 6 most common activities last year, in case you're wondering and thinking about where you want to go with your project or your plan, mental health navigators, we'll talk about that a little bit, but a mental health navigator or mental health coordinator who is not doing direct treatment with students, but is coordinating the efforts, working as a liaison between families, providers, and schools, that position is an allowable expense in this grant. They also looked at improving their social emotional learning and trauma for their universal strategies. It included referral pathway development, making sure that there's a clear and concise way for students to be referred both through school-based mental health providers as well as community, screening, and suicide prevention. New for this year, the grant period is longer. Everybody rejoice, it's now 2 years. It is always going to be based on the biennial budget cycle. It was last year as well, but it was the first year of the project, and the state legislature only allocated money for 1 year of funding. Moving forward, you will have the opportunity, you'll write the grant, you'll have the opportunity to receive your grant amount for 2 years. So if you write it for a $75,000 grant, you'll get that in year 1 and you'll get it in year 2. The other thing that we're offering, and I'll explain why we're doing this, is you have a choice on the front of the application to choose whether you want to do a program development grant or program expansion grant. And essentially, we offer that for 2 reasons. One is it kind of helps when you look at the activities that may be under that project to give you a focus of where your project may have most of the activities. But it also is going to provide for us a way to group these grants for review. So what we found last year for reviewers is that some of the applications came from communities that had been doing this for a while. And so their applications looked like they had a lot of really great stuff going on. And then there would be communities that were just getting started, and theirs didn't look quite as shiny. Not that they weren't good applications and not that they weren't needed, but they didn't look as shiny. So we want to make sure that reviewers are going to review one set and other reviewers will review other sets, and that we hope will make it a pretty level playing field for review. Other also new is that all your applications will be submitted electronically only. You are not required any longer to submit a hard copy. So that's one less thing that can cause some slip-ups. We had a few applications that we could not review because they came in late. And all applications are going to be submitted as PDF documents. The application is in a fillable PDF form already. You may use digital signatures through Adobe if you have that capability with your Adobe software. If you do not, you can print them, physically sign them, and scan them back in as PDFs and send them together. The signatures and the required letters will not be accepted after the due date, which, everybody say with me, is May 1st. So please do not submit anything after that date and ask us if we can review. We just cannot. It is a competitive grant. The fact that there were 140 applicants last year and we funded maybe a third of them because that's what we have for funding, makes it a bit of a challenge when we are trying to review them and make sure people follow the guidelines. So get that application. You can get it in early. So we're hoping that you have more time this round, and please feel free to submit them when they're ready. The other thing is that the plan in the PDF, and I will show you this in a moment, has the application has a plan section, and we've recreated that plan section. And let's just open this link. It goes to the web page, and you will see that the application has a few new things on the front. We're asking you to include here your community mental health provider partner so that we can access that information quickly. We're asking for business manager and district administrator information. When we make determinations about the grant, it is your district administrator who will be notified about whether you are receiving the grant or not. That's just protocol to contact your administrator first. So if you are wondering, check with them first to see if they've identified that. The other thing we would ask is, we know that last year, and this is pretty common, that we'll have a number of changes in district administrators come summer. And if your district administrator information changes, if you will notify us so we can update the database so that we actually get the correct person to notify. The structure is not unlike before. You've got the project abstract. It is a fillable form, but it is a limited space. Abstracts are to be short. One tip for you about the abstract, write it at the end. It's going to be your best ability once you've got laid out your whole project to do a nice succinct application or a summary of your application. The narrative begins with your demonstration of need, just like before. Include local data, please. Don't rely on national data. Everybody has a need. Every applicant had significant need. Show us why yours is different. You've got your status of your current mental health resources. Include information there about how your collaboration is going with your community mental health providers. If you have none yet, state that. If you've got a collaboration but you want to leverage that better, state that. When you get to the plan, we created this a little differently for a couple of reasons. When you click on this link, PI 1818 page 8, it's going to open a Word document. The reason we did this section in a Word document is this is expandable. Our PDF software, the versions that we have access to, do not allow us to expand PDFs, create expandable PDFs. In this Word document, you are able to expand and add into this table if you need space for more activities. So that's why this is in a Word document. What you will do is you will indicate a statement of need from your needs section, and then you're going to create a goal to address that need. You're going to have measurable objectives, one, possibly more, for that goal, whatever baseline you have for that current objective. If you don't have any baseline at this point, you can just say none or 0, and then whatever activities you are going to do to reach that objective. We're deciding to use this form because that we found in the past that oftentimes people were not connecting their needs from the needs assessment to their plan. They might have something in their needs assessment that said that they had a fair number of students that reported that they had suicide ideation, but they're not addressing anything about that in the plan. This is going to force you a little bit to make sure that your needs, your goals, and your objectives are all aligned. Once you have a sheet for each goal, so when you have a new goal, you'll need to open this up and open it up and create another one and save another sheet. Each goal will get its own sheet. Each goal can have multiple objectives and activities. When you save this as a PDF and send it with your application as a PDF. So John, I'm going to check with you and see if there are any questions up to this point.
No, nothing's come through as of yet.
Well, thank you, sir.
You're welcome.
So in the application itself, we give you
Oh, wait,
a,
wait, wait.
okay,
Sorry, Brian says he has one. Right
okay,
away, Brian. He's probably typing right now.
okay.
That's putting any pressure
Do,
on him.
do, 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 do.
Okay, so she said each goal gets a new sheet.
Yes.
Trying to understand what that will physically look like.
So if on the screen, I have the application up and we give you an example of what one sheet might look like. Now, if you have, this goal is to offer mental health literacy program to adults and students to increase their ability to recognize and respond to mental health challenges. Here are your objectives, your baseline, and your activities to address that. Given this is an example, you may have far more activities than this. This is just try to give you an idea. Now, say you also have a goal to increase students' universal mental health protective factors through social emotional learning and or trauma. That would be another goal. You'd have your objectives, so you'd save that as a separate sheet. That would be goal 2. Does that help?
So you're saying, so make multiple pages of that sheet in the plan Word doc.
So when it opens up into a Word doc, you type in goal 1, save it as goal 1. Open it up again, and in that sheet, type in goal 2, save it as goal 2. And then you're going to save those. You can save them as Word docs initially, but before you send them, convert each of those pages. You could have 4, 5, 6 pages. We understand that. We just didn't know any other way around this so that you would have the room to expand for your plan. And then save those 3, 1, 5, 6, whatever, however many goal sheets you have as PDFs and send them as attachments with your application.
Okay, so Brian says he's got it. Okay, a couple more came in. Is
Yes.
there a greater chance of funding if there is a consortium of school districts?
It's a great question, and we get that a lot. No, not necessarily. What's really going to be looked at, and in the guidance document, you'll see the benchmarks or the rubric. What's really going to be looked at is how well your plan incorporates all those things. So you could have a consortium application, but you don't really address those things, or you could have a consortium application that does. I think for the decision making, it's not about whether it's going to improve your chances of getting the grant, but whether it's going to improve your chances of providing services. And with the consortium, one school district is identified as the fiscal agent. And so, making sure that if you're going to do a consortium with school districts, that there is an understanding about how that financial piece is going to work.
Okay, and then is there a set number of goals expected to be considered a quality application?
Another good question, and no. I would say that you want more than one goal. However, you may have one goal with a lot of objectives, and then that might suffice. John, as an evaluator, I don't know if you have anything to weigh in here about this, but I think it has to do more with, are the needs that you identified being addressed in this plan?
Yeah, I mean, I'm more of a quality, not quantity type of guy. So I mean, if it takes one goal, and you gotta be realistic about the time frame too. I mean,
Yep,
you don't want to throw a bunch of stuff at the wall that stepping back, you couldn't accomplish. So
exactly.
yeah, I mean, a solid application that's reasonable that accomplishes a fair amount. Yeah, I mean, if it's one goal and it's a really good goal and it's a high density goal, a lot of meat to it, that would certainly be fine.
And keep in mind, you don't have to address every need you have. We recognize that. And also note that as you lay out this plan, once you're in, if you are awarded the grant and you're in the process and you find that it is way too much, you certainly can alter that plan. So don't feel like, you're going to be stuck with this intensive plan. We do understand that that might change. Looks like there might be more questions.
Um, yeah, so we got one more. Then for year two, if you completed an activity, you do not address it year two and can create a new goal for year two. So I think if you complete your activity and you do not address it by year two, can you create a new goal for year two? Basically change midstream a little bit.
So the way that we're going to work this is much like the AODA projects. So you are going to submit, this is really good. I'm glad you asked this now. I think it comes up again. You're going to submit a plan and a budget for your first year of your 2-year project, knowing that you're already thinking about what you might do the second year, knowing that some of those activities may continue into the second year and you may have new ones. Grantees then will receive another, it's like a application or referral grant process application mid-term in the grant, so near the end of the first year, in which you will submit any modifications to your plan and a budget for the second year. So as you're planning this, think about this in terms of what are your focus, what's your priorities for the first year. And you might even think about what you want to hold off from your needs to the second.
All right, I think we're all up to date.
Excellent questions. Thank you all. Okay. So I talked about these changes in the application on the front page already, and I showed you how these, the previous application actually kind of merged the measurable objectives, local plan, and evaluation plan together. Note that for our purposes, yet again, that we only have 2 data points that we're asking you to collect. There is a section on there asking you about how you're going to evaluate your own work, and that isn't something we're necessarily we're not tracking that. So for example, you may have in there that you are going to do some sort of assessment or survey to determine whether students' feelings of connectedness have changed. We're not going to ask you to give us that data at the end. You will fill out an end of year report in which you will share some of that information, but it's not going to be something we're tracking. What we are going to track, what we are going to require from every applicant or every grantee is 2 data points, and they're fairly simple, so don't overthink this. The number of students that are seen by a school mental health provider, school social worker, psychologist, counselor, nurse, and the number of students that are seen by a community mental health provider. Count students only once. So if Joe Jones sees the psychologist and the counselor, he's counted once. We're just counting the number of students that are seen, independent individual students. You get to decide at the school level what constitutes a mental health consult or touch. I firmly believe that our school-based mental health professionals have the knowledge to determine whether a student approaches them, whether it's just a consult and just dealing with a he said, she said, or a temporary problem versus what they would consider a mental health consult. So it's not a perfectly clean number, but we wanted something that if a legislator said, tell us why this program is working, and we can say this number of students across the state were seen by school professionals and this number by community, that can have some impact. So that program implementation plan is to help kind of clean things up. We noticed in the past, reviewers would tell us that they had a hard time tracking in those older applications what the needs were and how the objectives connected to actual needs. And we often had a lot of times folks would list goals as their objectives, or they bring things into the plan that were never mentioned in the needs. I kind of like my little suitcase metaphor here. It's packing cubes. That's what our program implementation is. It's packing cubes. So are you going to do a program development grant? You may, if you have a limited or no collaboration at this time with the community mental health provider, if you're trying to develop that. If you don't really have many mental health supports currently in your school, and if you really haven't started doing mental health services to students or supports and you're just beginning. Now, keep in mind, you get to determine where you're at with this point. There's no right or wrong answer for this, but keep in mind that similar applications will be reviewed by the same people. Program expansion grants might be something that you're thinking about if you already have collaborations with providers and existing agreements. Maybe you have some supports in your school, but you're just looking to expand those. So maybe you have a program for 9th graders, but now you're looking to expand it to older students. We had some schools that have really robust collaborations in place with providers in the building providing services through contract or through MOUs that are billable, but now they're adding to expand on that, they're doing screening. You also maybe are looking at having programs and supports in place, and you're looking towards sustainability. So maybe you're funding a mental health navigator with this, but you're looking at ways to start building collaborations so that moving forward, the funding for that position can come from county and providers and school all working together for that. That's just some examples. You get to choose. But what I will say is if you're doing a program development grant and you're just getting started, this is competitive, so make sure it's robust. We had, some folks that thought that submitting a plan where they were going to meet with collaborators, mental health providers 4 times a year to get things started. Okay, but when that was compared to another district that was going to do the same, but they were going to meet monthly, one sounds more robust than the other. So consider that. And expansion grants, you're going to want to make sure that you're looking at how you're going to leverage what you have. How is this funding going to help expand either the quality of the supports that you're offering to students or the number of access points you're offering to students? So for the PDF, for the application, the PDF, just a couple other things that I haven't mentioned. Do not take this PDF plan and download it into Google so that people can work on it together. I love Google. I think it's a great tool, but it does not allow applications to go back out to their original source applications without all kinds of problems. And we had an application last year in which it appeared that somebody put it into a Google Doc and brought it back out, and the plan and the budget were all messed up and we couldn't read them. So don't waste all that work and all your time by submitting an application that's not reviewable. Keep it in the PDF. If you need to do Google so that people can share, just copy and paste the sections and put that into Google, but make sure that you keep it as a PDF. The only attachments we want are your MOUs or your letters of commitment from your community mental health provider and your scanned implementation plan. Do not send us letters of support from all your collaboration partners. Just send the 1 or 2 letters from your mental health providers. Some of you actually have the luxury of having multiple ones. So if you are getting MOUs from multiple providers to commit to this work pretty equally, you could submit those, but we just can't. We found last year that people were sending pages and pages and pages of attachments, and it's just too hard for us to keep track of all of that. So the ones that you are required to attach are your MOU or your letter of commitment from your mental health provider partner and your implementation plan. Please don't send others.
Hey,
now
Beth,
with the, yes.
you good for a couple questions?
Sure.
Okay, so we don't get too backlogged.
That's good.
One is, okay, if we are applying as consortium, then do we count all students from the districts applying?
Yes, just send us one total number from each. Like one total number for the consortium of school-based, one total number for, would you say that's correct, John?
Yeah.
Okay.
Yeah.
Yep.
Question number 2, are you approving a certain number of program development and program expansion applications?
No. So we aren't allocating certain money just to those, and we aren't allowing just certain numbers of them. It's more for you to guide how you might choose your activities and your focus, your goals, and for the review process. If we were to get a lot more money in the future, we might look at doing that differently, but for now, it's just simply your choice, pretty much about where you want to be reviewed.
Yep, and then the last question for now, what if, as part of our program development application, we include a health screening component, which you cited in the PowerPoint as an element of a program expansion?
Yeah, that can be there. Those were just examples of how other people expanded. But we've had people that are just getting started using screening processes. We would encourage you, especially if it's fairly new, that you consult we've got a screening guidance document about some things to consider before doing behavioral health screening. But that can certainly be an activity in a program development grant. Keep in mind there's nothing solidly one or the other except the collaboration piece. Because if you don't have community partners that you're already working with, part of your goal and part of your work in this plan is going to be how you're developing those partnerships and building that collaboration. Whereas people who might choose the expansion grant, for example, have that in place already. Now you may have partners and you don't feel it's a very strong partnership. You could choose either way. So the expansion or the development is really entirely up to you.
And then a follow-up question that Brian asks, where's the guiding document for behavioral health screening that you referred to?
So I will link that on the mental health page. but if you go to the DPI website and in the search box put behavioral health guidance, it should come up, but I'll link it on the page.
All right, we are all up to date.
All right. So the budget, it is a bit of a bugger sometimes. Make sure as you type numbers into the budget that you tab, because as you tab, it will tabulate. That's a good way to remember that. And if you don't tab, it's not going to tabulate correctly. Make sure that your budget detail matches your budget summary and aligns with your activities. Please don't put something in your budget that we cannot go back and find in your plan. So so for example, in-state conferences within reason are allowable expenses for staff. But when they show up in the budget, we need to see where in the plan that you've included that. So for example, staff are attending CISA 5 Mental Health Summit so that they can better prepare something and something and something and how it will impact kids, right? So you want to show in your plan, if that's one of your activities, how that impacts kids. If you put it in your budget and it is not in your plan and we can't find it in your plan, if you get approved, we will deduct that amount from your total budget. That's what we had to do last year. So make sure that anything in your budget tracks back to your plan. The guidance document this year, it's wonderful because people have lots of questions about woofer codes and budget categories and fiscal reporting. That is all listed in that guidance document with links to people, contact links for who at DPI can help with the business piece of that and all of those questions. The other thing too about the budget, please, please, please make sure that your budget total matches the amount you're requesting on the front page. So we had some applications that requested $75,000 and their budget came out to $64,700. They got $64,700. It's just easier for us if you make sure that that matches already. I said this before, make sure you complete the budget for the first year of funding only. You will do a renewal application if you are awarded this grant after the first year, and then you can change, modify your plan and budget. So here's some things to keep in mind. Speaker and training fees and assemblies, one-day sorts of things, they're limited to $1,000 per day. Incentives, building modifications, and by building modifications, I'm not talking about building rooms. I'm talking about, you know, putting in privacy equipment or putting locks on doors to protect records, things like that. Those are non-capital expenses. All of that is limited to 10% with one exception. We had some applicants this year who wanted to purchase mental health equipment, and that would exceed the 10%. You are allowed to exceed the 10% for mental health equipment of that non-capital expense. All other non-capital expenses are limited 10%. That also means that you can have some of those other expenses up to 10% and the telehealth, because we recognize that as an intervention. So it's not an or, but it can be an and. There are no out-of-state travel conferences for adults or events for students allowable. One of the things that we have to do, if asked, is justify how this money was spent. And you know, we had an application for a significant amount of money for adults to travel out of state, and we just did not think that if a legislator asked us why that was used, we could justify that. Conferences have limited impact on student outcomes and student supports. So if you are going to conferences, find some way to make sure that you are utilizing what you gain from those conferences to provide back to students. We understand you also sometimes require food for events and trainings, but that needs to be within reason. Even at the state level, that has been significantly curtailed for us. So just make sure that they're within reasonable limits and that they're in the plan. So if you're providing food for a training and you've got an activity for an objective where you're training staff, indicate in there that it will be full day trainings that includes lunch, something like that, so that we know. So of course, the most major required activity is that you're collaborating with your mental health agency to provide these resources and services to pupils. Show in your plan where that is happening. We need to see in your plan where it says people responsible that you have your community mental health providers being responsible for some of this, whether it's you know, communicating with parents or communicating and collaborating with teachers, whatever that might look like. We also are going to continue from last year the same, that grant funding cannot be used to pay for direct treatment services. We have to bill third parties. This is mostly, well, there's a couple of reasons for this. Big one is this is a sustainability issue. School districts are cutting back on all kinds of things to use school funding to pay for services that actually have another source of funding, such as billing, is a pretty slippery slope. It's also an ethical issue if funding runs out and a student no longer is able to get services. This also, though, means, and we understand that this is a struggle, so for a lot of people it's not even that, but it's the students that have insurance with high deductibles. The funding can't be used to supplement that. That's a much bigger issue that shouldn't fall on the schools to figure out how to do that. That should be a conversation with your providers and your communities. We've had a number of different ways in which communities have looked to do that. And you know, I understand that that's a challenge. So what we're not saying that, you know, you have to tell us how you're doing that, but just know that you can't use grant funds to do that. You also want to work with people to find ways to cover uninsured. We have found that a number of families that appear to be uninsured actually have access to insurance. They just don't know how to get there. So mental health navigators, coordinators, school personnel have helped them access insurance options. The other thing that we've added this year to this guidance is a little bit more information about the requirement to follow all laws regarding licensing and supervision. There is more information about that in the guidance document. I provide for you the exact legislative statutes that dictate these requirements. We have had questions about whether schools can directly hire state licensed, DSPS licensed therapists on staff. You're not contracting with them. You're not, they're hired as employees to provide services. We're looking to provide some extra guidance for that, aside from the fact that that could violate some of the laws regarding licensing for state licenses through DPI for schools. It's also opening up a number of vulnerabilities to school districts. So for example, DSPS licensed therapists do require supervision, and it depends on the type of license they have. School people are not in a position to supervise those. And so what could happen then is that you could be liable for lawsuits as well. So just really, that is not something that the DPI endorses. We're not the police, we're not going out and checking, but know that there are a lot of risks to doing that. Community mental health providers must bill for services when they can. We've had some folks that are contracting with districts to contracting with providers to cover costs for that. If a district decides to do that with their own funds, I think that that has some potential unintended consequences as well. But that is not up to us, but the grant funding cannot be used for that. And I saw there was a hand, and I'll check for questions in a moment. One more thing, too, is that the grant funds are to supplement, not supplant. Some of you that have done grants before are familiar with this language. Essentially, what that means is that you can't use these funds to pay for services or personnel that were being paid for prior to the grant. So you can't use this now to pay for your school social worker. However, if your school social worker was part-time and now you're adding another half-time position to that social worker to do mental health coordination services, and it's work of the grant of your plan, that half-time can be funded by the grant. So, John, questions?
All right, so in regards to what you talked about hiring a therapist, would a request to hire another school counselor be considered?
So you can use the dollars to hire for positions. So if you hired a new school counselor, as long as that school counselor's role was doing work of the grant. So for example, if you hired a counselor half-time to do additional groups for kids as part of your grant plan, in your plan you would have that as an activity, and that the person responsible is the school counselor. So you just need to make sure you're showing in your plan where those positions are. So positions that can be funded, extra time for DPI folks. It could be funded for a mental health coordinator who does not have to be licensed because they aren't directly seeing kids or doing a job that the school-based personnel would. They're going to communicate with parents, liaison. We've had some schools that the mental health navigator has been a parent, some it's been a nurse, some it's been a school-based person, some it's been county, and some it's been provider. So that's really entirely up to you.
Then there's a follow-up. Can you tell me how many requests for additional school counselors were approved last year?
Um, so I cannot tell you exactly how many that is. I can tell you that there's some districts hired. So, and it wasn't just school counselors. That's what makes your question a little bit muddy for me. Some people increased counselor time. Most of them didn't hire brand new full-time people, but some did bring them on for that. Some increased school social work time. So I can't tell you the number. And as far as approved, if it's in your plan, any position in your plan that is 0.5 or more FTE, you will need to submit a job description just so that we can make sure that it is an approved person and position. But if you are increasing or adding a school counselor to do work directly related to the plan, and the activities in the plan are allowable activities, it would be approved.
All right, and that's it for now.
Just keep in mind that all these positions that are being funded by this money, that's a bit tenuous. So I would suggest that if you're looking at any positions funded here, particularly full-time ones, that you think about in your sustainability section, how you're going to go about finding ways to fund that if it's beneficial, if you find it's beneficial. This funding can be really helpful getting a position in place so that you can collect some data and make your point to school boards or community members about how important it is.
And then, sorry, Beth, we had one more question just came
Yep.
in. Can we collaborate with DHS to partly fund one of their social workers to work directly in our district if they are supporting the plan?
The only way that you could do that is that they're also DPI licensed. So you cannot hire a social worker to come into the school district that is not DPI licensed. And those license statutes are listed in the guidance document.
And I think we're good.
Okay. But collaborating with your county is a really great idea to get services to kids. So we had one district that I think hired one of the community social workers part-time to be the coordinator. They didn't do treatment services, but they were the coordinator. So that's up to you. So this slide is just linking you to a couple of resources if you haven't seen the mental health framework, and within that framework is a needs assessment. If you are looking for resources to start looking at your needs assessment for your application, your data collection, kind of where your needs and gaps are, this is one resource that can help you. Another is the YRBS. Many of you have used the YRBS. There have been some changes in this process, however. Notice that there is a link online. It is now a 2-year cycle, and in fact, the window is closing soon. So please do not submit any questions to me about the YRBS. My colleague, Kate McCoy, is the person who is overseeing this project. So if you want to go to this web link here, you can get more information about the YRBS, but it's a great resource for data, and many of you already use it. So these are allowable activities. I know this comes up. So you've got your collaboration, you're planning your application and your plan with your provider. Keep in mind that we really like to see, one of the things that can enhance your application for the reviewers is that you've included parents in this process. Maybe you've surveyed parents about what sorts of supports and things they feel their students need. Maybe you've included them on your collaboration team. Student voice is also one of those things that helps to enhance your application. That being said, these are other additional allowable activities at the different areas. Universal strategies that we've seen on the applications and are allowable are SEL, trauma, resiliency, suicide prevention and bullying prevention, stigma reduction, building mental health literacy for students and adults, youth mental health first aid, signs of suicide, sources of strength, for example, built-in family supports, having a family liaison, having the community mental health collaboration. You can use funds to pay for your providers for their time to come to meetings if you need to. You can pay for their travel if you need to. You can pay for travel for students to get to treatment, especially over the summer. We've had some districts that, because the providers aren't going to be in the schools, they have some funding set aside to pay transportation for students to get to the treatment. Selective screening, co-led groups, this is something people don't always know about, but your community mental health providers can come in and work with your school-based providers and do co-led groups. So maybe you have a school social worker and your community provider doing a grief group or a wellness group for kids. You can do wellness planning, mental health navigation, peer parent supports, community mental health consultations. So maybe your community mental health providers want to come in and consult with teachers about a student. They can get paid an hourly rate for that. They may want to come in and do some training on, maybe they're going to do a training for school staff on suicide and anxiety. That could be covered at an hourly rate as well. And looking at your referral process and your follow-up. Do you need to pay people for meetings outside of work, for example, to do that? We get a lot of questions. Can this pay for school staff that are coming in the summer and doing planning? Absolutely, and it can pay for an hourly rate for your providers if they're coming in to do that consultation with, or that planning with you. Mental health navigation and, sorry, I'm having a hard time. I've got something over my screen here. John, can you see those other ones under mental health navigation? All right. Okay, John, any questions at this point?
Okay, yeah, Sarah's still on mute when I was trying to answer a question. So one question, we completed or two of them. We completed the YRBS in 2018. Is it okay to use that data?
Absolutely, yes. So you may not be able to get your most recent data till April, and given that the turnaround time for this grant is May 1, use whatever most recent YRBS data you have, yes.
And then, so Laura question, can a district contract with county human services to provide a social worker for 1, mental health navigation services, and 2, direct services to students?
Mental health navigation, yes. Direct services, no. Direct services would need to be an MOU in which the provider could have space at the school but would need to bill for services, but not as a contracted employee. And then, because you can't use the grant funds to pay for that treatment service.
And then can a contracted social worker get an emergency DPI SSW license?
Yes, but they'd have to go through the process to do that, which means they have to enroll in a program. So we have had some districts do that. Oh. Just one thing I do want people to be really cautious about. If a person is doing treatment, mental health treatment, it's a bit different than school-provided treatment services. And there's a reason that treatment providers, community providers carry insurance in the event that they get sued for that. So if you have somebody that is hired by the school district that is doing treatment, and say, God forbid, that you have a student that attempts a suicide or completes one, and that provider is sued, the school district can also be held liable for not adequately supervising. So just keep some of this stuff in mind. You can get these treatment services to kids without these folks being hired as school employees. And if providers are telling you they can't, then I have to ask why, because sometimes it's easier to get a salary and benefits and time off than it is to bill. But we have the resources to bill for most kids.
Okay, and then one more question just came in.
Mm-hmm.
Okay, we are in the program development application category. Since the grant requires collaboration with a community mental health provider, though we cannot use grant funds to pay a community mental health provider to provide direct treatment, but that is the provider's only desirable role, direct treatment. Can our plan state that we've teamed with them, but then all of our explanation of budget be for things that do not pay the community mental health provider?
Yes, and so what that looks like, for example, is they still get to do direct treatment, but your MOU with them may include access to space on your campus or in your school to provide that treatment. The way that you collaborate with them is how you set up your referrals. So, for example, as a School psychologist, I would see kids, but I would know at some point that they may require, and this is part of your referral process, what are your cutoff points, that they require additional, more direct treatment as opposed to what I can provide them. So then there's a referral option for how you are referring kids into those providers. You're making it easier for students to get to treatment by bringing providers to the school, for example. And then the provider is going to do what they always do. They're going to bill for that service, whether it's billing the student's private insurance or whether it's building Badger Care, they will bill for that service. Now, what providers have told us is the benefit to them to doing it this way is that they have fewer no-shows when they show up at school for appointments. So students might have an appointment with the provider who's 40 minutes away, and they just, for whatever reason, parents have an emergency, something happens, they can't get there. Providers report more no-shows that way. They report better statistics when they are providing treatment in the schools. So your collaboration with those folks, the mental health resources are much broader than simply just the funding can cover many, many more things besides treatment. So we ask you to think much bigger about what mental health services and supports look like for kids. That includes treatment, but is not simply about that. Other questions?
That's it for right now.
Okay. So allowable activities also include training. So maybe you need to pay somebody to train staff or time for staff training. So if staff are coming in after school or in the summer or on a weekend to get trained in an activity related to this grant, they can be paid. It can be paid for curriculum, signs of suicide, second step, bully prevention activities, sources of strength, okay? It can be used for materials for implementing programs. It can be used for screening materials, and salaries and fringe for your salaries and fringe are for your school-based people. It can cover substitute teacher costs if you are bringing, maybe you have a provider that's coming in and working with teachers and doing some consultation, and you get subs that rotate through the different grade levels. That's all okay. And food may be purchased within reasonable limits, as I mentioned before. What I ask you to do is, when in doubt, do the legislative sniff test. If a legislature were to ask me or you why you use the funding for that activity or those materials, would you be able to say without a reasonable doubt that that is necessary or beneficial to the outcomes for student mental health and wellness? So that's what I ask myself every time anybody calls me with a question about something allowable. Would I be able to justify that to the people that allocate the funding? Just very quickly, we've got about 10 minutes here. There's some really good information about how to connect a plan. And we find that people often confuse goals and objectives, and here's just a couple of different examples. Increase the number of students who access community mental health services as a goal. One of the objectives for that might be, by 2021, the number of students who attend a session with the community mental health provider will increase from 12 per year, presumably that's your baseline, to 25 per year as measured by the referral pathway data collection sheet. That is an outcome objective. But with a 2-year grant, we know that a good number of your objectives will probably be process objectives, and here's what that might look like. Your goal is to develop a comprehensive referral process. An objective: by June 2020, the mental health team will develop a referral pathway process to be used by staff, parents, and students to refer students for mental health services. It's a process objective because you'll know it's completed when you have that referral pathway completed. Identify students who are depressed and/or anxious. By 2020, 80% of 9th grade students will receive a depression screening to identify those in need of additional services. That is an outcome. By January 2021, the number of K-5 students, okay, so I have a box at the bottom of my screen I can't get rid of, so you can read that one. So how does that look when you put it all together? So your goal leads to your objectives, and then your activities show how you're going to meet those objectives. In this example, increase the number of students who access community mental health services. By 2021, the number of students who attend a session with a community provider will increase from 12 per year to 25 per year as measured by the referral pathway data collection sheet. You saw that on the last slide. Possible activities just in this example. Mental health navigator and the mental health team will develop a process to track referrals. Mental health navigator will contact parents to determine if student attended a mental health session with community mental health provider. So questions about that?
Okay, we have two questions right now.
Yep.
Let's see. One is asking you about your familiarity with the CBITS program in Madison.
Yes.
And then a person asks, could this grant help cover the cost of partnership with Journey Mental Health? The cost covers database, screening, and group facilitator with school social work and counselor.
So for CBITS, yes, and CBITS has been an activity that some applicants used in their grant funding for. So yes, and then yes, what we found is that what some districts did is they contracted. So it's not a direct treatment service, correct? So they contracted with, in your case, you're talking about Journey Mental Health. In other places, it was other parts of the state, it was other providers who did screening and consultation with school-based folks. So yes, that would be allowable. So it's not direct treatment.
And then the other question is mindfulness curriculum and training considered a mental health student support as long as we have identified the need?
Yes, it's a universal strategy. Mm-hmm.
Right.
So that's allowable as long as you have your collaboration with your mental health provider, which is the required activity.
All right, we're good.
Okay. So I want to just tell you a little bit about the review process. In the guidance document, you'll see the scoring rubric. John helped me work on that to make it a little bit cleaner for everybody so that you'll see. I'll show you a picture, a screenshot of that in a moment. There's 2 phases to the review. So once we get the applications in the first, we need some time to divide those up and get them to 2 reviewers. And the external review will include a reviewer that is throughout the state, generally, that is not a DPI employee, and then we will also have DPI folks who help support the review. Each of your applications will be reviewed by 2 reviewers externally, scoring them according to the rubric, and each reviewer will then have an average score, and then the 2 will be averaged together till you get a final score. It's out of 4 points. Am I correct, John? I think?
Yeah, I believe
Yeah,
so.
I think so. And this last round, all applications that scored a 3.75 to a 4 were funded, I believe. So the external reviewers will submit their rubrics, and then we generate a list of highest scoring to lowest scoring. And then we go as far as we can for the funding that we have based upon the requests. And then we do an internal review process. And the internal review process is those of us on the DPI team working on this project, confirming those ratings, making sure that the applicants are eligible. So for example, we had one that, as I said before, did not have a provider as a partner, and that one was not eligible. And then we also double check that budget items are fundable, that the plan and the budget match, and all those sorts of things. And we will make modifications to those budgets if we notice that there are errors or you have something in there that's not allowable. We had a number of people that exceeded the 10% non-cap limits, and so we had to make an adjustment for that. And then we have to present them to the state superintendent for approval. And then once that's all done, we will notify all of your district administrators. So you see that this is a bit of a time-consuming process. We take very great care in making sure we do the review process as unbiasedly as possible. We make sure that the reviewers don't have any conflict of interest in reviewing your applications. So keep in mind that it takes some time, and we understand everybody wants to know, but we're doing the best we can to make sure that it's fair. So the rubric looks like this. You will see in the application the guidance document, the entirety of it. But we made it a little clearer for you under each section. You'll notice that under project abstract, there's 3 criteria. Under demonstration of need, there's 4. And I would just say that if you want any general how-to guidance about writing a grant, make sure that if the application is asking you to address 4 criteria and statement of need, you address those 4 criteria. Even if you told us something about that in your project abstract, even if you've said something about it in another part of the grant, if that section asks for it, tell us what we're asking for. Don't just assume that you can not answer those questions, because that's not going to be reviewable. The reviewers are looking at these criteria. It's also not a bad idea to use the rubric while you're writing the grant, just to make sure that you're addressing those things in your application. And another recommendation, if you are so inclined, is to have somebody who did not write the application with you review it using the rubric to see if they notice anything you missed. It's really easy being in the middle of writing this that you completely forget, or you know what you meant to say, and so you can't make a very discernible decision about whether it's clear to somebody else. And then here's one more final thought on that. We do not have a score per se for spelling and grammar, but they do make a difference, and we're educators. And please make sure that you have somebody spell check it and review it so that it looks like you took some time to do that. These are some common mistakes. I know we're running out of time. There are missing sections of the application. You don't provide what's requested. Just make sure I've mentioned almost all of these things for you, but here's it kind of in summary. There's some information in here. I'm not going to go into it, but think about all the different all the grants that you're applying for. If you're not the same person that's doing your AODA grant or your Title IV Part A funding, talk to each other so that you aren't double using money for the same thing, for the same activity or the same resources. It's a good way to strategize your funding. So I will open this up for questions here. For those of you that have to get off, while I'm answering those questions, there's my email, but I do have a booking page. If you follow that link where you can set up to a 15-minute consultation. If you feel you need more than that, book for 2 consultations where I will call you and we can answer your questions more directly or privately. So John, what questions do we have?
So far, just one. Can you repeat the total score calculation that was funded last year?
I think it was 3.75 or higher. So grants could receive a score up to 4. John, am I correct on that?
I think so, but it was a pretty high bar.
Yeah.
I mean,
Yeah.
As you talked about, we had a lot of applications, and we couldn't fund even half of them, right?
Yeah. So what we did is we had all the scores from 4 all the way down to the lowest score. We looked at how much money, 3.25. All of that money goes out the door. We aren't holding on to any of it at DPI for my services, John's services, or anybody. So it all goes out the door, and we just went down. The very last funded application, we had to check with them to see if they would take less because we were able to offer them what was left. More money means we can go deeper. So really good applications didn't get funded, but that's because it was a resource issue.
No new questions as of right now. I don't know if someone's typing or give them a little bit.
So we had a couple that showed up in the question section. If we applied last year and we're not funded, can we request a copy of readers' comments? Yes, absolutely. Send me an email that says through Open Records request you would like copies of your rubrics. Please put in your email your district that submitted that application so I can find your rubric without having to track you down. And we will get that to you. You can get that. And I will there will be a PDF of the slides today. It will go online where you found the link to these webinars. Anything more?
Doesn't look like it.
Okay. So if questions come up, please feel free to contact me. Note that you probably want to check the guidance document and the frequently asked questions document. There's one there. The frequently asked question document goes into detail about statutes regarding licensing, for example. You might find what you're looking for there before contacting me, but I am available. So thank you, everybody. Have a great day and stay warm.